Welcome to G Fun Facts Online. Have you ever imagined a future where surgery is performed not just by human hands, but by the steady, precise arms of a robot? Well, that future isn't a distant sci-fi fantasy. It's happening right now in operating rooms all over the world. Today, we're diving deep into the incredible world of robotic medicine, a technological revolution that's redefining the very essence of surgery. Now, when you hear robot surgeon, you might picture a shiny droid making decisions on its own. But that's not quite the reality of today. Currently, robotic surgery is all about teamwork. It's what experts call a human-in-the-loop approach. A highly skilled surgeon sits at a sophisticated console, often just a few feet away from the patient, and controls a set of robotic arms. These arms, equipped with tiny miniaturized instruments, mimic the surgeon's hand movements with incredible precision. Think of it as the ultimate power-up for a surgeon, combining their years of experience and critical judgment with the flawless dexterity and steadiness of a machine. So what does this mean for the patient? The benefits are huge. Because these robotic arms can work through tiny incisions, just a fraction of the size of those in traditional open surgery, the whole process is minimally invasive. This leads to less pain, smaller scars, and a much lower risk of infection. A massive analysis of over 100 studies involving 14,000 patients found some stunning numbers. Compared to open surgery, robotic surgery cut blood loss by over 50%, reduced the need for transfusions by over 27%, and slashed hospital stays by nearly 70%. Patients get back on their feet faster. And for the surgeons, they get a super-powered view with high-definition 3D cameras, and the robotic arms can twist and turn in ways a human wrist simply can't, all while filtering out any natural hand tremors. It's a win-win. The pioneer in this field is the Vinci surgical system, which has been used in over 14 million procedures since it was first approved back in the year 2000. But the game is changing. As key patents expire, new players are jumping in. We have Japan's Hinotori system with its immersive console, the versatile Vinci system, and the Monarch platform, which has already performed over 20,000 lung biopsies. There's even the CyberKnife system, which uses a robotic arm to deliver highly focused radiation beams to zap cancerous tissues with sub-millimeter accuracy. The next giant leap is the fusion of robotics with artificial intelligence. Again, this isn't about replacing surgeons. It's about making them even better. AI algorithms are being trained to analyze surgical data to help surgeons identify tricky anatomy or even predict potential problems before they happen. Imagine AI handling routine, repetitive tasks like suturing with perfect consistency, freeing up the surgeon to focus on the most critical parts of the operation. We're even seeing early examples of automation. The Smart Tissue Autonomous Robot, or STAR, has already successfully performed a complex surgical task on its own, under the watchful eye of a human surgeon, of course. This is just the beginning. Of course, it's not all smooth sailing. These robotic systems are incredibly expensive to buy and maintain, which is a major hurdle for smaller hospitals. And surgeons need extensive, standardized training to become proficient and ensure patient safety. These are real challenges that need to be addressed for this technology to become truly universal. So, where is this all headed? The future is mind-blowing. Scientists are working on microrobots, tiny enough to travel inside the body to perform procedures without any external incisions at all. The rollout of 5G connectivity will supercharge telesurgery, allowing a specialist in one city to operate on a patient in a remote location on the other side of the world. By combining robotics, AI, and immersive technologies like augmented reality, we are creating a data-driven, hyper-personalized future for surgery. The journey is well underway, promising a world where surgery is safer, less invasive, and more effective for every single one of us. Thanks for tuning in to G Fun Facts Online, and we'll see you next time with more amazing science.